and childbirth are major life stressors that can provoke or aggravate affective disorders. This includes mood disorders such as prenatal and postpartum depression, postpartum psychosis, and bipolar disorder, in addition to anxiety disorders such as OCD or obsessive compulsive disorder, generalized anxiety disorder, panic disorder, social anxiety disorder, and certain phobias and post-traumatic stress disorder. Mood disorders involve a disturbance in the function, affect, or thought process. This can negatively impact the family as severely as a physiologic problem. A big issue to remember when dealing with any sort of mental health issue is the stigma that many people feel. They don't want to be labeled as crazy or nuts, or in the case of postpartum depression or psychosis, a bad mother or wife. It's important that the woman feels empowered to speak up for herself and seek the treatment she needs. Remember, this is still an illness, even though you cannot see necessarily physical symptoms. I wanted to start out with a video that will give you a nice glimpse into how it feels to have postpartum depression. So let's get into depression. So peripartum depression pretty much encompasses when a depressive disorder occurs during pregnancy or postpartum. Perinatal depression is one of the most common medical complications during pregnancy and postpartum, affecting about 1 in 7 women. So how do we define postpartum depression? This is a major depressive disorder during which a depressed mood or loss of interest or pleasure in daily activities occurs for at least a 2-week period of time. In addition to that, they also have to have 4 of the following: significant weight change, either loss or gain, more than 5% of their body weight in a month, insomnia or hypersomnia, changes in psychomotor activity such as agitation or just that sluggish retardation, decreased energy or overall fatigue, more than would be expected after having a baby, feelings of worthlessness or guilt, difficulty thinking, concentrating, or making decisions, or recurrent thoughts of death or plans or attempts of suicide that occurred during pregnancy or the first 4 weeks after birth. This is an emergency. Very important. The defining difference between postpartum depression and the postpartum blues is that postpartum depression is disabling, and the woman is really unable to safely care for herself and or her baby. So postpartum depression occurs in up to 20% of women, and the cause is really unknown. Although there are some theories, including interactions between biochemical, genetic, psychosocial factors, and life stresses. Some risk factors, and probably the biggest risk factor, is having a history of postpartum depression or a personal history of depression or anxiety. Other risk factors include immaturity, low self-esteem, history of medical problems during pregnancy or after birth, childcare stress, inadequate social support, that lack of sleep, financial worries, particularly those with a low socioeconomic status, and for those people who just have chronic life stressors. So postpartum depression is most likely to occur during the first 3 months postpartum, although it can occur anytime during that first 12 months. That depressed mood with a loss of interest in usual activities and the loss of usual emotional response to your family. And again, those symptoms are going to be present for at least a 2-week period, although they do tend to worsen over time. This list just kind of refreshes on some of those symptoms and manifestations that patient might experience. So dependent on the severity, a patient is likely to have some sort of combination of psychotherapy, increase in social supports, or maybe prescribe some sort of medication. The family should really participate in the counseling, and this will help them understand what the woman's feeling and how to address her needs. Medications generally revolve around SSRIs or tricyclic antidepressants. You must consider if they're still pregnant or they're breastfeeding to make sure that the safest option is chosen. Women who discontinue their depression or anxiety meds with pregnancy are more likely to have issues and relapse with that anxiety or depression. Electroconvulsive therapy, or ECT, is generally reserved for suicidal mothers who have not responded appropriately to any other treatment. So now let's get into the medical emergency, postpartum psychosis. This is a mental state in which a person's ability to recognize reality, communicate, and relate to others is impaired. These are the women that you hear about on the news that drive off a cliff with their children in the car. This is a psychiatric emergency requiring immediate hospitalization and evaluation. They are at risk to themselves or to others. Postpartum psychosis is a variant of bipolar disorder and is the most severe form of postpartum mood disorders. The onset of symptoms is typically pretty rapid and can occur as early as 2 to 3 days after delivery. Luckily, it's not that common. Risk factors include a personal or family history of postpartum psychosis or women who have a history of bipolar disorder. Manifestations include that frank psychosis, paranoia, grandiose or bizarre delusions, usually associated with the baby. They can have cognitive impairment, grossly disorganized behavior, agitation, irritability, and very rapidly shifting moods. Management is hospitalization. Again, this is an emergency. They are going to get started on some sort of pharmacologic treatment. They're going to get intensive psychiatric care. And if all else fails, they may also receive that ECT. So as you can see, peripartum depression, postpartum psychosis, and other mood disorders can have catastrophic effects on moms, babies, and their families. Women and her family should be taught how to recognize these signs and symptoms of these mood disorders and depression and psychoses, and be encouraged to seek treatment as needed. I generally speak to all of my patients about the signs and symptoms of postpartum depression, and I really try to drive home that the partner may be the one who notices the symptoms first. It's really hard when you're in the middle of all of this and you're tired and everyone is bothering you that you may not realize those symptoms. So it's really important that the families are also aware of these symptoms of it and really encourage that mom to be able to speak up.